Okay, we'll make a start. Thanks, everyone. Thanks for everyone joining and for all the participants coming in from around the countryside. I gather that it's reasonably cold in Canberra and looks like it's going to be wet. I'm in a reasonably warmer Brisbane tonight. And thanks everyone for taking the time to join us. So we've allowed 1 hour for tonight. And the last 20 minutes or so will be allowed for Q&A if we need it. So please feel free to type in your questions. The panel facilitators will try and collate those into a number of key questions because we won't have time to answer everyone's questions. But please feel free to send those questions through and hopefully we'll get to most of them by the end of the time. So quick change around in our timetable. We're just going to allow Chris Parker to speak first before we go to Tom Black's. Apart from that, we'll stick to the agenda. So we're all aware of the possible implications of foot and mouth disease from an on-farm point of view, at least those who attended the seminar, and what we might be able to do about it going forward. Probably the lesser known is what are the implications on the trade markets if we happen to get lumpy skin disease or foot and mouth disease in Australia. And obviously this in the first instance affects the exporters, but with a country that exports 60 to 70% of its product, that amount of product coming back on the domestic market will have huge implications on the price that people will receive back on the farm. So we felt it was one of those things that we don't want people to panic, but we want them to be aware of the possible implications should this happen going forward. So I'm going to in the first instance, hand over to Tony Ma. Tony's as you'd all be aware, is the CEO of the National Farmers Federation. National Farmers Federation has been part of the lumpy skin disease, foot and mouth disease task force that I'm chairing at the moment since its inception. As I might have mentioned in previous webinars, that task force now goes out to pork, wool, sheep, dairy, and the red meat sector. So, Tony, I'll hand over to you to take us through industry update on trade and protocols from the working group. Thank you.
Sure, thanks, John. Good evening, everyone. I'm going to talk for a couple of minutes and then hand over to Charlie McAlone, who's just going to take us through a little bit of the detail. But as John alluded to, we're here tonight, of course, talking about the potential trade impacts from an emergency animal disease outbreak. The focus has perhaps rightly been on foot and mouth disease. We currently, of course, do not have foot and mouth disease, and we'd like to keep it that way. Likewise, we do not have lumpy skin disease, and we'd also like to keep it that way. So worth reiterating those two facts. We should also recall that recent government task force examined Australia's preparedness in the event of an outbreak of exotic animal disease and found that it was sound and strong. But we also know that the threats and risks are increasing. The risk of an FMD or an LSD incursion is low. Expert judgment has assessed the risk of an FMD incursion in the next 5 years at 11% and 28% for lumpy skin disease. So while we tend to focus on foot and mouth disease, worth recommending or reiterating that lumpy skin disease is 3 times the risk incursion, given its ability to be carried by weather events such as storms and cyclones. So with that, let's look at what we're dealing with here. And as John said, I'll try and set the agenda a little bit in terms of the trade implications, and Charlie and Tim and Tom are going to go through a little bit of a detail. Starting at the top, Australia's total value of agricultural production is agreed to be about $86 billion. And the value of exports for this year is expected to be a record $70 billion. So in anyone's language, what is at stake here is a large proportion of the GDP from agriculture. And I'll come back to the numbers in just a moment. But again, in terms of setting the scene, it's worth reiterating that Australia has been, is, and always will be export dominated. This trade-related agenda and reality has been hard fought in what is an incredibly competitive global market. Australian farmers and the supply chain that works with them have largely been the envy of the world, not only for the quality and safety, but increasingly the way that products are produced. So reputation, recognition, perception in the marketplace is important and incredibly valuable. So this outstanding and much sought after reputation has driven market access. It's also driven market segmentation, and that has materialised in premiums and priorities for Australian agricultural products around the world. And this is apparent in the market, but also in global trading frameworks. Australia is officially recognised by the World Organisation for Animal Health as being free from foot and mouth disease without vaccination. And of course, recent outbreaks in FMD in Indonesia has increased awareness about any outbreaks should they be found to be in Australian products or in exports. Australia's export certification is largely aligned with the World Health Organization Terrestrial Animal Health Code, which recommends that importing countries have controls in place to prevent movement of potentially infected animals. So animal products or formites from affected countries or zones. This means effectively that an FMD outbreak in Australia would have a significant impact on our ability to export animal and animal products. So following any FMD incursion in Australia, the two main causes for the exports of susceptible products to be halted are that Australia is unable to meet existing agreed certification import requirements with our trading partners, or a trading partner implements an emergency response which bans the import of certain products from Australia. So coming back to the numbers, if Australia exports about 75% of what we produce, the total value of the figures on the screen, which I think you can now see, is quite significant. And it's fair to say that it's likely to be a conservative assessment of that impact. ABARES and Tim and or Tom will take you through a little bit of this detail, but ABARES have recently estimated a large multi-state foot and mouth disease outbreak has an estimated direct impact over 10 years of $80 billion. So looking at that screen, you can see beef, sheep meat, dairy, wool, all significant in terms of the value of billions of dollars of trade, and that would effectively be immediate. As I say, it's expected that that would be a conservative estimation of the outbreak and the impact to meet legislative and international obligations in the event of an FMD outbreak and to avoid reputational risk. The Department of Agriculture will immediately suspend the majority of animal and animal products and engage comprehensively with trading partners to assess what markets and what priorities, and Charlie's going to take us through a little bit of that. The department would then focus on efforts to restore or trade with those markets. So what have we been doing? The Trade and Protocols Working Group that John alluded to before, comprised of industry and government, has been working through a range of processes. And Charlie, you might like to take us through now just a couple of those aspects that the protocols and trade group have been working on. So I'll hand over to you.
Thanks very much, Tony, and good evening, everyone. So Charlie McAlone, General Manager of Trade and Industry Strategy at Dairy Australia, and I've been co-chairing this Industry Trade and Protocols Working Group with Tony, which is a subcommittee of the cross-industry task force that John McKillop is chairing. And we thought it was important that everyone has a bit of a context on the processes and machinations that are happening behind the scenes in terms of getting on top of the issue around LSD and FMD and how we are dealing with some of the trade risks that are out there in the marketplace at the current time. And this working group is a key part of that. And it's been a really impressive example of coordination and sharing across the agricultural sector because we're all experiencing a lot of questions and queries coming our way about different market impacts and how we're going to deal with this trade issue, bearing in mind that the significant costs that Tony's just outlined. So you can see there in terms of the group, which was established back when originally there was very much an LSD focus back in May this year, and since it's taken on more of an FMD focus as well, we've taken on Australian Wool Innovation and APL have joined the group. In terms of reference areas, the areas where we're focused, a lot of that has been around understanding the potential impacts and working with government to really work out where are the priority markets, where are the market risks, and understanding the protocols that exist across the globe with key markets, health certificate needs that obviously have a broad bearing on our agricultural trade should and if we have an incursion of lumpy skin disease, foot and mouth disease, or any other diseases. But most importantly, it's been really important mechanism for us to streamline our engagement with the Australian government and ensure that we've got alignment in terms of the outcomes and issues and views that the government is working towards, and that's been a really important part of the process. So just on the next slide, Charlie, I think a key part of what we in this Trade and Protocols Working Group have been looking to do is how can industry play a constructive role in helping to secure our international markets, bearing in mind that we recognise that ultimately the government, it is a government-to-government engagement when it comes to trade protocols, market access conditions at a government-to-government level. But there is an important role that industry can and does play in this regard. And if we look at it, the extensive international networks that we have across organisations like MLA, like Dairy Australia and the like, a lot of those networks and engagement and international footprints provide a significant source of insights, of data, of market intelligence about these markets, about their needs, about the sensitivities they face, and about how we can actually align and tap into their understanding so we can support our own collective needs in the most effective way. It's also important to understand that with some of those networks and those connections with industry, there are great examples of organisations like LiveCorp and MLA who are using their programs in market and their networks to build collaboration about how we can manage these diseases in markets like Indonesia, and in doing so reduce the risk of an incursion, which then leads to all the trade implications that we're very aware of. We're also very keen, doing some work in this area of science around the biosecurity risks. From a Dairy Australia perspective, we are about to embark on a study working with the government, looking at the issue of pasteurisation on lumpy skin disease virus and its effectiveness as a kill point of that disease, which has broader implications about how we can then engage with the international community about the risks of LSD transmission through products with countries who have lumpy skin disease, and that's going to be an important piece of work that industry is working with government to deliver. That will also play an important role in feeding into that market access process. But importantly, and as I think we've got some Tim from MLA will be talking a bit more about some of the variations of different examples of foot and mouth disease in particular, and how long those markets have taken to get back into the market. And one of the key elements here is making sure that if we do have an incursion, firstly making sure we try to avoid at all costs getting an incursion, but if we do, to make sure that we have our AusVet plans, our FMD and LSD manuals up to date. We've got training and education of the people around those manuals. We have through chain biosecurity plans, and we have effective communications networks and response mechanisms in place so we can get on top of any incursion early and reduce the time that we can get back into the market. So that's really important role that industry is playing, working with government to feed into this market access debate. So with that, I might hand back to you, John, for the next speaker.
Great. Thanks, Charlie. Thanks, Tony. Very comprehensive update. A lot of work has gone into those individual working groups, and I think we've been through those before, but there's 6 of them. A lot of work. That's where the grunt work is really done within those working groups rather than within the task force itself. Okay, so I'm going to hand over first of all to Dr. Chris Parker, First Assistant Secretary and National Animal Disease Preparedness Coordinator. Chris will be familiar to many of you, a vet by background, and has also been on the industry task force for LSD and now FMD since its inception as well, and has been an invaluable contributor to it. So I'll hand over to Chris.
Thanks, John. I thought just worth reflecting on a couple of things, and then I'll pass over to Tom, who probably has far more interesting information than some of the stuff I'll give out tonight. But it is worth reflecting, I think, just on the task force report that Tony Marr mentioned at the start of the webinar. I think it's worth looking at that task force report, and that's on the DAF website, and I'll put the link into the chat or provide it to colleagues as we're going through this evening. But I think that the task force focused in particular on how the biosecurity and the emergency management systems work together and how they interact, and I think that's really important. We're quite, I suppose it's quite an advantage having a minister at the moment who happens to be the Agriculture Minister and the Emergency Management Minister, and I think he was very keen that those two parts of his portfolio responsibilities linked up in this emergency animal disease space. As Tony mentioned, the task force found that overall the system really is quite well prepared and robust. But there are some improvements that can be made, and it made 14 recommendations, and I suppose the key ones are really about updating coordination arrangements between biosecurity and also the emergency management. And I think also looking at some of the accelerated work around communications would be particularly important in a stock standstill if we were to have, FMD or LSD come into the country. I think probably developing the capacity and the plan around what a workforce might look like and what workforce requirements might be there. And I'm talking about vets and epidemiologists and animal handlers and people to vaccinate, all those sorts of things. And then also building on our national data capability. All of those are vital components also of this trade discussion about being able to identify areas of freedom very quickly, being able to identify those sorts of areas. So when we have discussions with trading partners, we're able to look at how and what the requirements they have for us to be able to get back into markets is. I mean, as you all know, FMD and LSD would require a response on a much bigger scale than probably what we've been used to, even with something like equine influenza a few years ago. And we know that we need to do the work now to be prepared as possible. We need to do the work now to understand the trading impacts, and that's what tonight's about. And we also need to recognise that Australia's world-class biosecurity system has kept this country free of these diseases for 150 years, and we're still free of them, and we continue to update that work and continue to work extremely hard to ensure that we are free of these diseases. John, I'll quickly just reflect on the situation in Indonesia, because I think we've seen a bit of press around that, particularly on the ABC, and some footage of animals with FMD in Bali. Of course, there's still animals with FMD in Bali. What we do know is that the Indonesians are making a significant effort, particularly on Bali with vaccinations, and the Australian government's donated 100 million doses, nearly all of which have gone to Bali, been distributed. They're now being put into animals, both small stock and cattle. We've also had a lot of training go on with people to vaccinate animals in Bali. We haven't changed our border settings, folks. There's still active infection in Indonesia, and we have very stringent controls at the border that were upgraded a number of times and continue to be reviewed. So although you might see that, it's not unexpected, not something we didn't expect, and I just want to assure folks that those sorts of protections that we've had in place for many years, the border and the increased protections we had are still there. But that said, tonight's about trade, and Tom, I'll pass over to you, Chair. I hope that's okay that I've put him, or I can pass back to you and you can introduce him. I'm happy either way, but Tom's a very valued colleague and extremely experienced in this trade space, including spending significant amounts of time overseas as a overseas agricultural counsellor dealing with trading partners. So thank you, Chair.
Thanks, Chris. Yeah, just quickly introduce Tom. First time on the webinars. Tom's the Acting First Assistant Secretary, Exports and Veterinary Services Division. So looking forward to hearing what Tom's got to say with all that experience. Over to you.
Thank you, Chair, and good evening, everyone. And before I start, I do need to, I think there may have been a little bit of false advertising kicking around, suggesting that Nicola Hinder was going to be speaking this evening. Nicola extends her apologies. She's actually leading an Australian delegation to a food safety forum in Europe at the moment. And while she'd intended to speak tonight, we just couldn't make it work. She's actually chairing a session right now. So I'm here in her stead, and I'm actually doing her job for a few months. So really pleased to be here and to be able to speak to you all tonight. It's a really interesting time. And as Chris mentioned, I was fortunate enough to spend 4 years working in Southeast Asia as our agriculture councillor there in the mid 2010s. So I spent 4 years based out of Bangkok, but working through a number of these markets where things are serious at the moment with these animal diseases. So certainly brings it very, very close to home for me. It's my pleasure to speak to you tonight to give you a brief rundown on the trade preparedness work the department's been undertaking. You're probably going to hear a few things from me that is repetition of stuff that a couple of our speakers have already mentioned, and possibly even taking some of Tim's thunder as well. It's actually not a bad thing that we're pretty aligned. It means that we're all on the same page. I will say that some of our numbers might differ slightly. I think the departmental numbers that you'll see in a moment are pretty conservative. So the numbers that Tony flashed up were a little bit more. He notes that his are conservative. I'd note that mine are perhaps even more conservative. So using that as a base point. I also note that in the interest of time, we don't have too long this evening, but I will not kill you with death by PowerPoint. I only have one more slide after this one. So as outlined by the previous speakers, and as you're all very aware, the threat of foot and mouth disease and lumpy skin disease is very real for Australia at the moment. It's spread to some of our closest neighbours. It's a credit to our, as Chris mentioned, it's a credit to our excellent biosecurity system that we remain free of FMD and LSD, and long may that remain that way. And it's important that we continue to be there. However, just because we've kept the diseases out, and let's hope that we continue to do so, it doesn't mean that we should not prepare for the worst. And so we've been getting into that and looking into what an incursion might mean, particularly in the export space. So over recent months, the Department of Agriculture, Fisheries and Forestry has been prioritising work to enhance preparedness for our export system in the case of an FMD or LSD incursion. I want to give a shout out to the departmental folk that have been leading this work, Dr. Anna Somerville from Exports Division, who you probably already know, and Dr. Peter Finnan from the Animal Biosecurity Division, Chris's space as well, have been leading this work with their very capable teams. And there's been a huge amount of in-depth thinking from all our technical experts in the department about what we can do better, prepare for the worst. We've been working really closely, though, as been outlined by our previous speakers, with industry and our state and territory government representatives. We've literally been putting our heads together to understand the impacts, share information about what can be done before, during, and after a disease incursion to mitigate and manage some of the risks of our export of animal and animal byproducts. Can we move to the next slide, please? So a key component of our thinking has been assessing the expected impact to our exports. To do this, the department's reviewed the export requirements relating to LSD and FMD. From this, we were able to get an idea of what trade would be impacted, and by that I mean effectively immediately suspended in the event of an outbreak. As you can see here, a change to Australia's health status for FMD or LSD would have major impacts on our agriculture sector. A broad range of commodities, including meat and meat products, dairy, animal and edible products, so that includes wool, skins and hides, pet food and rendered products, live animals and their reproductive material would be affected. The extent of impact certainly differs between commodities, though. And as I mentioned earlier, all the figures that you see on this screen are estimates only, and we think they're pretty conservative. So if there was an incursion of either LSD or FMD, we understand that trading partners might react differently to what we anticipate and or place unexpected bans on other exports as well. So we think we've got a pretty good handle on it, but we just don't know how trading partners may react for some of the commodities that may be a bit of left field. So again, we think the trade impacts are likely an underestimation at this point. As you can see on the side for LSD, it has a large impact on Australia's agricultural exports. It is estimated that an incursion of the disease would have an impact of approximately 7.39 billion annually, and you can see the breakdown of the impacted commodities on the image to the left. With a broad understanding of the impact of an LSD impact on 19 July this year, the department held an industry consultation workshop to align our thinking on trade preparedness for LSD as part of the development of the National Action Plan for LSD. While LSD is a disease of cattle and buffalo, and when compared with FMD, the total impact on exports is less, the department has already started working with our trading partners to minimise the trade impacts, as was agreed at the workshop with industry. On a similar note, just last week, on the 29th of September, the department led a workshop to discuss impact analysis and the strategic approach for preparing our exports in the event of an FMD outbreak. Again, this was another excellent discussion where we learnt a whole lot from our industry and state and territory government colleagues. And perhaps to no surprise to anyone, it became really apparent that FMD would have a major impact on many agricultural sectors. You'll see on the image to the right, and you'll also see in Tim Ryan's presentation later on today just how significant that impact is. The figure for FMD, again, is an estimate of impacts on the top 10 markets for each impacted commodity. So it doesn't capture the entire trade, which explains some of the difference with Tony's figures earlier. Nonetheless, we're still looking at an enormous figure of around 14.63 billion per year. For FMD, though, the department is focusing our efforts on preparatory activities to streamline our response to help regain trade as quickly as possible once an outbreak is under control. We think it's much more important that we're prepared in the case of FMD and much harder to be able to negotiate now with trading partners around FMD. So I know that's a really high-level summary, but the key message that I wanted to leave everyone tonight is that the impacts for LSD and FMD are really large, but the department is really working hard with industry to minimise and mitigate trade impacts in the event of an outbreak. And we will continue to do so in the coming months and hopefully years. Long may we remain free of both these diseases. Thank you.
Great, thank you. We'll take questions at the end. Look, there's some really sobering numbers in that, and obviously the impact of either of those diseases would be huge on not just the industries in which we work, but the broader Australian economy as well, which is why the government is so focused on trying to prevent it from coming in, all those diseases from coming in, and then if it does come in, to control as quickly as possible. And then if we can minimise the impact on trade going forward as we recover from it. Okay, I've got one more speaker, Tim Ryan from Meat and Livestock Australia. He's the manager of the Global Trade Development and going to run through a PowerPoint with us. Over to you, Tim. Thank you.
Thanks, John. So I've got about 10 or so minutes, and looks like we're roughly tracking on time, so I'll try and stick to it. But this is just a presentation to run through, I suppose, some of the trade implications of an outbreak of FMD if it ever were to occur in Australia. I suppose just noting off the bat, I've only covered FMD in this presentation, but a lot of these implications and kind of lessons, I suppose, would apply to LSD as well. But as kind of Tom indicated, the overall degree of impact for LSD wouldn't be as severe as FMD, albeit it would still be very large. So I'll cover off on FMD in this presentation, but also just noting that LSD would have similar implications. I'll run through three key areas. Firstly, I'll just look at how meat is traded around the world with FMD in various corners of that world, and how meat can navigate that. I'll look at, I suppose, the ultimate impact of FMD on trade through firstly lost access, but also potentially through a change in Australia's reputation and potentially lost premiums in certain markets. And then I'll conclude by looking at, I suppose, timeframes, because a lot of the impact really depends on how long we're locked out of export markets for. Given MLA covers red meat, I've just got a chart here looking at the cattle, sheep and goat industries and overall export dependence of those industries. So this chart, you can see the green bars indicate how much of production remains on the domestic market for those three sectors. Yellow looks at ultimate boxed exports, and orange or brown is the live export component of that too. So the main point here is to note that red meat is heavily export reliant, as Tony mentioned. Similarly, many other of Australia's agricultural sectors are equally export reliant as well. So while exports are great because they add a lot of value for the sector, it does create a fairly significant impact when that export channel is disrupted in some way. So just looking at, I suppose, a world with FMD, this map on the left-hand side has the major exporting countries and the animal health status of those countries when it comes to FMD. So this is the World Organization for Animal Health assigned status. So I suppose the top status when it comes to FMD free is freedom straight out without any vaccination program in place. So the major meat players with that status are the US, Europe and Australia, as well as a range of others. And then after that top status, you've got either a freedom with vaccination status or some kind of zoning arrangement in place as well. So you can see there some of the South Americans or Russia have that kind of status. And lastly, there's those countries that have FMD but have an endorsed official control program in place to manage FMD and minimise risks when it comes to trade. So if we look at the presence of FMD around the world, and then we look at how much those countries are actually exporting when it comes to the relevant meat products, so that being beef, pork and sheep meat. This pie chart on the right-hand side looks at the share of global trade as apportioned by that status. So the main take home here is the vast majority of trade across the affected meat products is from a country with an outright FMD free without vaccination status. So this just really emphasises the importance of maintaining that free status. There is trade that can occur outside of that status, however, and either under a vaccination program, a zoning program, or even an endorsed official control program, there is the potential for trade to take place, but that may be following fairly protracted and rigorous negotiations with the exporting and importing countries. So they're not something that can be turned on overnight. So really critical for Australia is maintaining our disease-free status and accessing those premium markets as such. Just looking at that same pie chart now, but in one more level of granularity, we can also look at the split of beef, sheep meat and pork traded under those various statuses. On the left-hand side, we've got beef, and so you can see there about half of total beef trade is under an FMD free without vaccination status. But there is a fair bit of product coming out of South America, either under a zoning arrangement or a vaccination status. So while that can take place, a lot of those South American exporters don't have access to the premium markets that the likes of Australia would. So while trade can occur, it is quite limited, and that's on the back of fairly significant negotiation. And you can also see there in pink on the left, the portion of trade, and that's primarily Indian buffalo meat that's taking place under an official endorsed control program. So that's also possible, but also India would have access to even fewer markets again compared to South America. And lastly, you can see there's 1% of beef traded globally is from a country without an FMD status whatsoever. So that's primarily South Africa. And again, South Africa has very few options, and particularly few premium options when it comes to selling beef. Moving on to sheep meat, the vast majority of sheep meat is traded under an outright FMD free status, and that really reflects the fact that most sheep meat is traded out of New Zealand or Australia, and to a lesser extent Europe. So no surprises there that the vast majority of trade is under a freedom status. And thirdly, just looking at pork as well, the vast majority is under a free status, but there is a bit of pork that gets traded, and that's mainly Brazilian pork into the likes of Asia under some kind of zoning status as well. We've also looked at similar figures for live exports, and similar conclusions can be drawn whereby the vast majority of trade occurs under a free status, albeit there is trade in livestock, particularly between African and Middle Eastern countries, that can take place either under a different status or no status at all. But the main conclusion here is when it comes to trade and keeping premium markets, we want to maintain that free status at all costs. The other implication of a change in Australia's disease-free status could be the potential premiums that we earn in export markets. So on the left-hand side, we've got that same map I showed earlier, and on the right-hand side, we've got the average export price of frozen beef into the Middle East. And we've picked the Middle East, given that's one of the few regions where everyone in the world is fairly active. And you can see there, on the left-hand side, the average Australian export price was $9 a kilo last year. If you compare that to some of the South Americans, such as Argentina and Uruguay, which still produce a reasonable quality product, there was about a $2 or 20 to 25% price difference between them and Australia. So there could be short and long-term implications for Australian exporters if we lost that status and consumers weren't as willing to pay such a high premium for our product in export markets. So I suppose bringing some of these factors together, probably one of the most comprehensive bits of analysis was done by ABARES in 2013 and updated fairly recently. And they quantified the overall economic impact of an FMD outbreak in Australia if it ever was to occur. So they put the figure at about $80 billion, as I think Tony mentioned earlier, and that on the right-hand side you can see was distributed across a range of channels. The first thing I just wanted to flag is the actual control costs of addressing the disease dwarfed by the impact on export revenue across Australia's various agri-exports, particularly noting that beef and sheep meat would be the most affected given their size and export exposure, but dairy, wool, pork and a range of other commodities would also be affected by an FMD outbreak. So another key driver of that overall impact is ultimately the time frame that Australia could be locked out of export markets for. And this is, I suppose, the big unknown, given there's huge variability, as we've seen with other outbreaks overseas. And also it's heavily dependent on the context of any incursion into Australia. So firstly, I suppose, looking at that initial outbreak period, some recent modelling using the department's ADIS model has done a range of scenarios that looked at potential outbreaks taking anywhere between 8 to 195 days, but most of those outbreaks were less than 30, so relatively confined compared to some outbreaks overseas, but huge variability and dependence on the real context of an outbreak. But given Australia's systems and ability to respond to an outbreak, we'd be in as good a position as many to minimise that outbreak period. I suppose the second timeframe component to be mindful of is how long it takes to regain our animal disease freedom recognition by the World Organization for Animal Health, or previously the OIE. And this process would at least take 90 days, and looking at other developed country outbreaks often takes less than 200, but could take considerably more again. So a bit of an unknown, but at least 90 days until that process could proceed. And then beyond WOHA recognition, it's really the requirement of some or many of our exporting markets or importing markets to recognise our disease-free status beyond WOHA. So looking at, for instance, the United States and how they've treated FMD outbreaks in exporting countries around the world, they've taken anywhere between 47 and 560 days past WOHA recognition to recognise the freedom status of that country. And then beyond that, there could be other ongoing implications such as consumer demand or consumer concerns about our status as well. But ultimately, the main aim of the game is to minimise the timeframe of each step in this process to ultimately minimise the impact on the Australian industry. So looking at that, some of those same factors, but in the instance of other country outbreaks over the last 2 decades, this chart here looks at firstly the outbreak timeframe, the timeframe for OAE or now WOA recognition, and then in grey how long it took the US to recognise the freedom status of those countries. So the main point here is that there is quite a bit of variability in the overall timeframe. And given Australia exports to so many markets around the world, there'd also be quite a bit of variability in how long each individual market, if they required additional checks in place, would take to recognise our freedom status. I've just got one more slide now, I suppose, looking at how long these outbreaks and the timeframe for OAE to recognise a freedom status. We can look at the UK example from 2001. So those signposts there look at firstly the timing of the FMD outbreak in green, and then in yellow how long it took the OAE to recognise the disease-free status of the UK. And then the bars in this chart look at monthly pork in red and sheep meat export volumes in blue throughout that time period. So the main impacts here we can see is on the outbreak or immediately post the outbreak, trade basically collapsed. And there was a trickle coming out of the country, but very little compared to what the UK was exporting prior. That picked up after the outbreak was controlled, but it was really after the OAE FMD-free recognition was granted that trade could return to some stable level. The other implication, I think, from this chart here is that even 3 years after the outbreak had occurred, trade had yet to recover to that pre-outbreak level. So there are lasting effects that we need to be mindful of when it comes to an outbreak such as FMD. I'll also note that we don't have beef in this chart here because beef was already heavily impacted by trade restrictions due to BSE in the UK. So that wraps up my presentation. So I suppose concluding, our disease-free status underpins market access, and on loss of that status, it would have very significant impacts for trade. And another key determinant of that impact would be how long we would be locked out of export markets for. But for that, there's a lot of variability and a lot of it depends on the context of an outbreak. But for now, I suppose we can be grateful that we are FMD free, we are LSD free, and hopefully we can continue to be so. That's all from me, John. Thank you.
Great. Thanks, Tim. Again, some pretty sobering numbers and all that. The one that I keep getting shocked about is is Ireland, who took 2 days to control FMD and 181 days to regain status again. You know, you'd think if you're that quick onto it and it was such a small outbreak that markets would forgive you, but they did somewhat quicker than others, but it was still 6 months before they were able to get back in again. Okay, so just clarify a couple of numbers there. Then one number from Tom was talking about the annual impact, which is where that $14.63 billion came from. The number of 80 billion is the cumulative net present value of 10 years of locked out of markets. So certainly that 80 billion is the real number, but the annual impact is the one that Tom put up there at 14.63. Okay, so we've got time for questions. We've got 15 minutes. So I'll go through these questions as I've got them there. I might start with one for Chris, because I know he's been doing some work on this. Has there been a recent assessment of likely pathways, e.g. illegal meat for FMD or weather patterns for LSD?
Short answer, John, is yes, of course there has. And I think we've had epidemiologists working on particularly LSD and chances of entry and where we see. And I see there's also a question in regard, is LSD inevitably going to spread through Indo and PNG? Look, it's spread by a vector and it will spread to where there's cattle. So yes, there is likely to be slow spread of this disease as we've seen it through the rest of the world. Vaccination is an important component of it, and the control, and that will remain an important component. It's important to just point out it's not close enough to blow in yet, and we're still getting a handle on exactly how some of the weather patterns work, and where are the likely places where it would land. There's a range of other things we need to consider in this space. PNG is a good example. Not a great number of cattle in PNG, so FMD would be more of a concern in PNG with the large number of pigs and those sorts of things. The other part we need to think about is what stocking densities do we need in the north to get establishment and spread of these sorts of diseases in Australia. So there's quite a bit of work that needs to be done. We also need to understand, particularly for LSD, what's the survivability of the virus on the mouth parts of the biting insect, because that's how it's spread. And then what's the probability of that getting into a cyclone, being blown into Australia, biting an infected animal? So there's a number of things that need to happen, and we're doing work on all of those things and all of those pathways. Clearly, FMD comes in regard to infected meat and infected animals. That's the most likely way it gets in. It would then need to get contact with a susceptible animal in Australia. So things like swill feeding of pigs are the concern. Things like people returning straight to farms and not following appropriate biosecurity measures where they've been to countries where they have FMD, of course, are also a concern, and that's where we put a lot of resources in at the border. Trust that gives some answer there, John.
Yeah, thanks, Chris. Absolutely. I suppose the next one then is we've partly answered it, I think, but do we have enough staff in place for the federal state agencies to manage an outbreak?
And I think that's one of the points that was highlighted in the Joint Task Force report that I spoke about at the beginning. I think what we're in the process of doing now is looking what our workforce looks like and what workforce is available. You know, from a Commonwealth perspective, there's 180 odd vets who are working in plant, who are our eyes and ears on the ground. They become available to be using. State governments have got them. There's a range of private vets. So there's a range of these things that are being worked through at the moment, John. Could I put my hand on my heart and say we could manage a year-long outbreak? No, I couldn't. But what I can do is say that workforce is now being understood, gathered together and trained to ensure that we do have the resources that are required. But it's something that exercises us. It's something that we're actually really quite concerned about. And I just point out for folk on the call, there is a big exercise next year called Exercise Preparedness, where we're going to be actually running a full-on exercise like we've got a disease. And I think that'll help also to highlight some of these issues around where staff might be, where they might be required, and how many we might be needed. So it's certainly something that's exercising us at the moment.
Yeah, because I might throw another one to you, and it's related to FMD and LSD being zoonotic. Human health messages going out there to prevent prevention campaigns. I might just get you to quickly talk about what happens at the airport and that exercise that you went through.
Sure. First up, LSD is not zoonotic, okay? It's not zoonotic. FMD in very rare cases has been. I think in all the world there's been 40 human cases of FMD, and it's been in 70 countries and those sorts of things. It's very rare and is not generally considered a zoonotic disease, FMD, but there are rare circumstances where it could be transmitted. Of course, those dealing with cattle will be in PPE, will be looking at those, how they might be actually vaccinating, treating, whatever they would be. Where there's active infection, people would be in PPE, so we're not seeing spread. It gets on the clothes, that people get dirty, spread it to the next property or whatever they're doing in a control situation. So in that respect, the messages that we'd be putting out are that product is safe to eat and to drink. Both LSD and FMD cannot be transmitted to humans through meat or milk or any of those sorts of things. But just to be certain, LSD is not zoonotic. FMD in very rare cases can be, and as I said, there's been only 40 cases throughout the whole world. I think I just checked with our chief vet actually on the on the text message there, and that's the information that he has. So it's not just Chris telling you; it's the chief vet of Australia telling you.
And Chris, I think it's fair to say that the majority of those cases were very close proximity from the source to the to where it was transmitted.
Yes, indeed, they were.
Yeah, I'm yet to see a case where someone's got on a plane, flown for 6 hours, and then driven for another 5 hours, and then spread that disease. Not to say it couldn't happen, and hence we've been very cautious at the border, but we need to keep it in perspective that it's not the greatest risk. The greatest risk is, and I'll be out of my depth in about 30 seconds, is from live animal trade, which we almost have zero risk in Australia, and the next is partially or undercooked meat products coming into the country, and hence that's where the focus is. Okay, a question then for Tony and Tom, who put up the numbers. Why are we so conservative in those numbers around the impact of FMD and LSD?
Yeah, thanks, John. I think it's a starting point. It's, you know, there's going to be a range of factors that we'd have to incorporate to get the actual number. It'll depend on the circumstances. So really, we know what the exports are, and that even that fluctuates itself from season to season. So really, for in terms of being conservative, it's a starting point, and it'll depend on a number of factors. The incursion, you know, a couple of other arrangements. So one guidepost in the discussion, I would say. Tom, I don't know what you think.
Yeah, no, I agree, Tony. I think the only other comment I'd make there is that there is the component of the third party, that being the importing country, and just how they will react. Like we have a pretty strong idea how they're going to react in the main, but there'll be some stuff in the margins in terms of how trading partners will react and what impact that will have across the board. I might add that we saw some really interesting stuff from Tim around time taken to get back into market. Those negotiations are, I have to say, they're going to be difficult and they're going to be challenging for us. There'll be the processes that we have to work through, but then it comes down to the bilateral discussion that we have with the trading partner. We're under no illusions that there will be some challenges there, and despite we'll have our animal health settings right. But who knows what trading partners might want from us in return. So I think we just need to be really clear-eyed about the challenges that those negotiations will be. So much better to stay free than end up in that space of having to negotiate back into markets.
Yeah, absolutely. And in case people are looking for examples of how that might work, not that the Philippines is a big market, but if we were to go to the Philippines and ask them to relax FMD, LSD protocols, they will then most likely turn around and say, we'll do that if you relax your banana protocols. Same with New Zealand. Okay, let's talk about fire blight in apples. So there's no way that the countries will not be seeking to negotiate a better position for their own products into Australia. Okay, one more question, and I'll put this back to Charlie and Tony as the chair of that working group. Have each of the industries been tasked with actions to limit trade impacts?
So I can start on that, John. I mean, I'd say there's been a huge amount that every individual industry is doing and has been tasked with doing in getting prepared and getting organised to try and help mitigate the trade impacts. I mean, most of those are actually to do with the preparedness and prevention exercises that we're undertaking through farms, on factories, through our tanker truck drivers, to make sure that we can get our biosecurity plans in place. There's a huge amount that we've touched on about industry training to make sure that we can pick up and identify any incursion as quickly as possible. And importantly, while we've got all these manuals and processes and procedures working through you know, what we actually do through AusVet plans and FMD manuals and LSD manuals and the like about what happens in the event of an incursion, there's a huge amount of work that goes in from industry to actually understand how those manuals and procedures work in operation. So again, we can help to mitigate the impact of any incursion, get on top of it as quickly as possible, because as we can see, The more effective we are at doing those things, the quicker we can get back into these markets and start generating some revenue from them. So a hell of a lot that's happened. And I haven't even mentioned things like, as I mentioned earlier, the LSD scientific work that from a dairy perspective, we're looking at the impact of pasteurization on killing off the LSD virus so it can't be transmitted through our animal supply chain. So there are things that individual commodities are doing that are very specific, but more generally, I think there's a hell of a lot that's taking place that ultimately is about mitigating the trade impacts of these incursions.
Thank you. Tony, do you want to add to that, or Tom? Tom?
Yeah, thanks, John. Look, the only other bit that I would add to Charlie's point there is any intel that industry can help provide us through your commercial channels in markets around market conditions, that will absolutely help us in terms of being prepared if we are in the worst case scenario of trying to renegotiate access. And we've obviously activated our counsellor network so that we're getting as much intel on the ground from our people right around the world around the various settings in different countries and how we can most quickly negotiate if we need to.
Thank you. Okay, just a question there, looking at the charts showing the before and after export in the UK, how much of that was the effect of just the lack of product coming out of those countries rather than the actual reluctance of importing countries to take product from those countries? Probably a question for Tim, I think.
Thanks, John. Tom, did you want to jump in there? You wanted to respond to that one?
Sorry, I was responding to the other one. So I think he's talking about your slide now. I'm not sure.
Oh, sorry.
Yeah, that's okay. Fire away.
I think it's hard to say. I suspect a lot of it was market access determined. And although the OAE would have reopened up some markets upon giving them an FMD free status, it would have been the case that many markets, even 2-3+ years after, took their time to recognise that same FMD free status. So I suspect most of it was market access related, but there would have been some consumer hesitation in there too, albeit much harder to quantify given, I suppose, the indirect nature of it.
Yeah, thank you. Okay, that brings us to the end of it. We're just on closing time, 1 hour, and I think we've pretty much done all those questions that were there. Thanks everyone for your time, for coming in. Thanks also to those presenters for speaking and putting together. It's a lot of work to put these together. And again, just I know there's some criticism, or has been probably in the past, about industry not doing enough. There's a lot of work has been behind the scenes. This task force has been made up of, as I said, the Department of Agriculture, RMAC and MLA, National Farmers Federation, Dairy Australia, Australian Wool Innovation and Australian Pork Limited. It's a very good example of cross collaboration in the agricultural sector. It's been working really well. There's a lot of work has been done, and I certainly appreciate the work that all those members of the task force and the working groups have done. But also appreciate the support of all those in the industry who taken time to dial in. Thanks everyone. Thanks for your time, and we'll have news about the next one in the next few weeks. Thank you.